Private hospital industry analysis using Porter 5 forces. First, competitions. In the hospital industry, the competition is highly intense as people has many choices of hospital or even clinics, including local public hospital which offers cheaper prices. Private hospital need to innovate and has advanced technology to stay in the industry. Threat of new entrants. Very low risk of new entrants because private hospitals needs high amount of capital, particularly for investment in technology and for R&D of own drugs. Threat of substitutes. The substitutes for private hospitals is low, but still people could substitute to local public hospitals or clinics or use traditional treatment. In many cases, private hospital usually known for effective and efficient technology for the treatment. Thus, some of the people would always prefer private hospitals treatments. Power of buyer. The power of buyer in the industry is low because usually people is more concerned about their health compared to the treatment cost as they have no choice at all. So they are willing to pay whatever price charged by the hospitals. Power of suppliers. The power of suppliers is fairly moderate. It is because, for example, the pharmaceutical companies have major roles in what specific drugs are distributed to the hospitals. The companies are keeping the hospital industries alive, thus hospital would buy drugs at whatever the price charged. The strengths and weaknesses analysis of KPJ. Strengths: it has a strong corporate brand name, one of market leader in private healthcare industry. It has major specialist services. It also has its own private nursing college, has strong financial support from parent company. KPJ's weaknesses are: it need to modernize information technology. It has growing competitors such as Columbia Asia, Prince Court Medical Center, and also Sunway Medical Center. It also offers expensive fees to customers. For Sunway Medical Center, the strengths are: it targets more customers worldwide. It has strong financial and brand support from the well-known Sunway Group. It rapidly expanding, provides scholarships for diploma and degree in nursing. And the weaknesses for Sunway Medical Center are: it has large competitors such as KPJ and also expensive fees are charged to the customers.
Next, we will continue with the risks regarding private hospital industry and how to manage the risks. The first one is cyber threat. The healthcare industry continues to undergo significant change due to the frequency and variety of new technologies being utilized across the care continuum, including devices, application, interfaces, and etc. This will result in instant access to sensitive information, and potential exposure expands at a rate with which even the most mature organization struggles to keep pace. Therefore, to manage this risk, private hospitals need to appoint skilled resources who can reduce the risk properly. Private hospitals also need detailed plans in addressing the technology expansion in advance by implementing proper processes and controls to allow for incident response and contingency planning. In addition, private hospital is also facing regulatory risks. The healthcare landscape continues to evolve, with regulatory changes and scrutiny on the rise. This trend continues due to pressure to reduce regulations and control regulatory costs. Therefore, to mitigate this risk, private hospitals need to maintain proper departmental coordination so that everyone remains on the same page, which expedites the risk management process and adds protection against malpractice claims. Management and staff also need to adapt to the changing regulatory environment and take more time to understand their regulatory obligations quickly. Last but not least, private hospital is facing reputational risk. This might happen due to the staff operation. It is mainly about patient safety and clinical operation, which might fail to prevent mistakes in the time patients admitted. Failure in preventing mistakes will result in damaging the reputations of private hospitals and unable to sustain customer loyalty and retention. Therefore, to mitigate this risk, private hospitals need to educate employees by covering all aspects of risk management and handle complaints quickly in order to reduce risk to the organizations. Private hospitals also need to do immediate correction of risks that are unavoidable with great accuracy and speed. According to the Office of the Inspector General, OIG, in November 2017, they found some fraudulent issues happened in Cleveland Clinic, Westland, Ohio. The fraudulent issues are billing for services not rendered, prescribing for unnecessary medications, and falsifying claims or diagnoses.
Healthcare KPIs are critical for any organization in the healthcare sector to keep track of their business performance. One of the KPI is the average patient wait time. It is useful for measuring and tracking business objectives around patient satisfaction and capacity management. Patient wait time can be calculated by finding the average amount of time a patient must wait from the moment they walk into the hospital or healthcare clinic until the time they are able to be seen by a healthcare professional. Other than that, bed occupancy rate. The bed occupancy rate measures the proportion of hospital beds in use at any one time. Bed occupancy is a good indication of a hospital's ability to provide safe and effective treatments to patients. Therefore, bed occupancy is a great KPI for measuring operational and capacity objectives. Once the KPI is measured and tracked, healthcare providers are able to estimate whether or not more space and beds are needed. The next one is average hospital stay. Just as the name implies, this KPI tracks the average length of time patient stays in the hospital. While this metric is very useful, it's also very general, using average hospital stay as a single KPI to track all the different categories of stay in your facility won't prove to be very helpful. The recovery from heart surgery will almost always be a longer stay than a patient who underwent a cataract surgery. Instead, this KPI should be broken up and used for each category of stay. After some analysis of the results, healthcare facilities will be able to create a target length of stay for each category. Furthermore, staff-to-patient ratio. This indicator measures the amount of staff resource present to attend to the patients in a hospital over a certain period of time. This KPI may require different ratios for different periods of time, such as morning shift and night shift, and should be broken up accordingly. Staff-to-patient ratio is a good indicator for business objectives that aim to improve the quality of patient care, as well as improving workforce sustainability. A higher staff-to-patient ratio implies a greater capacity to provide treatment and care to patients. First one is number of mistake events. In order to measure the effectiveness of a hospital in terms of its worker and the equipment available, this indicator is used. It counts the number of issues that can be categorized as mistakes made in a specific hospital over a certain period of time. Gleneagles Penang is a modern tertiary care private hospital strategically located in the heart of Penang Island. It was established in July 1973 as the first private hospital in Penang. Ivan Loh is the CEO of Gleneagles Penang Private Hospital. Ivan Loh uses coaching style to manage his staff. A coaching style is leaders act like a coach, command, and give away feedback in order to develop his staff to ensure a long-term success of the business. Other than that, Ivan Loh considered both financial and non-financial importance. He could identify the problems and improve the hospital's operation. Coaching style can also lead to frustration and disappointment when a coaching leader is forced to work harder than the person being coached. It also may be ineffective since it requires specific codes for every situation.
One example of successful company in this industry is KPJ Healthcare Berhad. It is known as largest listed healthcare group. 6 key strategies KPJ Healthcare Berhad are capacity building. They have strategic investment and enhancement in project development. For example, they have spent 70 million ringgit in replacing existing building of Tawakal Hospital after acquiring them. They also enrich customer relationship by taking strategic measures to attain and strengthen market loyalty, built upon a patient-centric culture. In addition, they also focus on innovation at the core by increasing application of medical technology as well as advancement in day-to-day management and operations. Besides, by introducing new niches, it means that they have unlocked new source of potential and growth that contribute to overall business development. Next, talent management, focusing on nurture dependable and high integrity talents who are capable of continuously drive positive performance. Most importantly, they also consistently improve processes and systems to effectively sustain the high performance in the industry.